Hello everyone, my name is Amin Ibrahimi, physical therapist, and today we're going to talk about physical therapy in sports injuries. Sports injuries have laid off many athletes for seasons, games, and worse, careers. Sports injuries are a part of everyday life for athletes and can be a serious obstacle that can affect the athlete's both physical and mental situation. Poor training methods, lack of conditioning, and inadequate warm-up are a few of the causes of sports-related injuries. In many cases, a sport injury is associated with limited mobility, pain, and swelling that interferes with normal body function. Athletes' health, athletes and team function, medical, social, and national costs are some of the effects of sports injuries. The most common sports injuries include knee injuries, sprains, shin splints, strains, swollen muscles, fractures, and dislocations. These injuries should be appropriately addressed in order to keep the athlete safe. In addition to injuries to joints, muscle, and bones, concussions are also a hot topic in sports nowadays. A concussion is a traumatic head injury that may result in bad headaches, a changed level of alertness, or even unconsciousness. One of the most effective methods of treating a sports injury is physical therapy. We are involved in the prevention and management of injuries resulting from sports. Physical therapists also play a huge role in helping athletes of all ages and all levels of ability to enhance their performance. This is usually achieved through a combination of manual therapy, range of motion exercises, electrotherapy, and rehabilitation techniques. Sports injuries are both preventable and predictable. With good knowledge of epidemiology, etiology, risk factors, and preventing strategies like specific exercises, the injuries can be prevented. And with proper assessment and taking good history from the athlete, you can find vulnerable parts of the body and predict the injury. The most important factor you should ask about is history of previous injury. Risk factors you should pay attention to are divided into intrinsic and extrinsic, controllable and uncontrollable. Uncontrollable intrinsic risk factors like age, sex, and height, and controllable intrinsics like athlete's level of fitness and biomechanics like bad landing. For extrinsic risk factors, uncontrollables like weather and controllables like match time and field for simulation. We have 7 principles of rehabilitation, which can be remembered as ATC is IT. A stands for avoid aggravation. It is crucial not to make the injury worse during a rehab procedure. Incorrect exercises or bad judgment have the potential to aggravate the injury. Timing. The therapeutic exercises should begin as soon as possible. The sooner patients can begin the safe exercises, the sooner they can return to full activity. Keep in mind that although rest is necessary, but too much rest can be detrimental to recovery. Compliance. Without a compliant patient, the rehabilitation program will not be successful. Inform the patient of the context of the program and set goals as a motivation. Individualization. An important aspect of physical therapy in the rehabilitation of a sports injury is the individualization of treatment to the needs of each athlete. Every athlete has different needs depending on the type of injury, age, fitness level, and athletic goals. A specific sequencing. A therapeutic exercise program should follow a specific sequence of events. This specific sequence is determined by the body's physiological healing response. Intensity. The intensity of the exercises must challenge the athlete and the injured area. At the same time, must not cause aggravation. Treating the whole patient. It is important for the unaffected areas of the body to stay finely tuned. This means keeping the cardiovascular system at a pre-injury level and maintaining range of motion, strength, coordination, and muscle endurance of the uninjured limbs and joints. Regardless of the specifics of the injury, there are fundamental components that need to be included in all successful rehab plans: pain management, flexibility and joint ROM, strength and endurance, proprioception and coordination, functional rehab, and the last but not the least, psychology of injury. Remember, injury is more than physical. Athlete must be psychologically ready and well motivated for the demands of his sport. Sports injuries do threaten athlete's career can have various consequences on his quality of life. At some point in the recovery process, athletes return to strength and conditioning that prepares them for return to play. Although the athlete may have recovered in medical terms, preparation for competition requires the restoration of strength, power, speed, agility, and endurance at levels exhibited in sports. Criteria for return to play must emphasize gradual return to sport-specific functional progressions. As Benjamin Franklin, American scientist and political theorist, once said, "An ounce of prevention is worth a pound of cure." Athletes can prevent some sports injuries with proper warm-up, stretching, proper recovery, and by working with a sports physical therapist. Thank you for watching this video, hope you enjoyed it, and I wish you all a safe and sound body.